And then it puts stress, on you and your wife, who's getting up, who's not, who's working, who's not. Childcare, which is a whole nother aspect of it. Reliable, dependable, trustworthy childcare for new parents is a whole new another aspect other than infant mortality, but we need to focus on that also.
Legacy Foundation is Lake County's community foundation. For over 30 years, we've partnered with donors and nonprofits, focusing on youth development, the arts, the environment, health, literacy, and other causes that matter to you. We're committed to Lake County forever. First Things First Porter County is dedicated to supporting families, healthy beginnings, and quality early learning, ensuring every Porter County baby is born prepared for a strong start in life. Learn more at firstthingspc.org.
I have a very strong connection to other students. Everyone makes an effort to help each other. I'll remember the feeling of being here, the feeling that I was a part of a family.
Additional support for Building Blocks is provided generously by Tom Sorlis and Sue Eleuterio, as well as Porter County Community Foundation, serving Porter County since 1996.
Building Blocks, the podcast, is a co-production of Lakeshore Public Media and First Things First Porter County. For more information on Building Blocks, including this podcast, as well as the television show, visit lakeshorepublicmedia.org/buildingblocks.
Hi. Today we have the pleasure of speaking with Congressman Frank Mrvan from the 1st Congressional District here in Northwest Indiana. It's an honor to have him here in the studio with us, and welcome to Building Blocks. Congressman Mrvan, welcome to Building Blocks. We are so thrilled that you have some time to spend with us today, and looking forward to hearing about how things are going with you and talking about babies and moms and the things that are going on in your world.
So, Mary Jane, thank you very much for allowing us to be here, and thank everyone part of the organization from Building Blocks. It's an honor to be here to be able to bring to light how valuable and important it is for us to speak up for vulnerable populations. And so I think through the duration, what we're going to talk about is how programs help mothers and infants for survival. And I think that we can have a robust conversation. As a local elected official, I've done programs that have supported this. And as a member of Congress who now is on the Appropriations Committee, I will continue to fight and advocate from every mountaintop and every valley to make sure our vulnerable populations are taken care of.
We are so lucky to have you as our voice in Congress right now, so we thank you for that. I found a quote that I'd like to hear your thoughts about. The former president of Malawi, Joyce Banda, said that the seeds of success in every nation on earth are best planted in women and children.
I think that's very profound. Women and children, obviously, our population has to continue to grow and nurture our children. I think that in this day and age, as I mentioned earlier, we have to look out for vulnerable populations. So when we take that quote, which is global, and we bring it home to Northwest Indiana, we have to understand that statistically here in Lake and Porter County, the statistics of infant mortality and mortality for mothers are extremely high. And so if we can come together in a collaborative effort to work together and make sure we give the resources necessary to great groups that can have an impact, then we're doing our part. And so what we have to do is accept quotes like that and understand the value of motherhood and children. And then locally here in Northwest Indiana and Porter County and LaPorte County, we have to act upon it. And we have to make sure the resources get to the organizations that have outcomes that show that they're saving people's lives, that they're providing self-sufficiency, that they're providing children who would be at risk but now are thriving. So if we can continue down that path and keep that formula together, I think we are going to be successful or plant the seeds here in Northwest Indiana.
That's right. One of the things that we talk about on Building Blocks is the first 1,000 days and how critical that is for a child's development. It really sets the trajectory for the rest of one's life. And what we know to be true is that it really takes one person in that first 1,000 days to be madly crazy in love with that child. And I'm wondering, Congressman Mrvan, if you probably can't remember, but you can probably pinpoint somebody in your life who was madly crazy in love with you, who brought you to this place where you
Other
are
than
today.
my wife.
Okay. Thinking back to those first 1,000 days.
Yes, the first 1,000 days, obviously my mom and dad, my grandmothers, my aunts and uncles, all of those things where that we were able to have support. My grandmother would come over and take care of us when my parents were working, and my mom and dad. So very critical. I mean, I don't remember my first 1,000 days, but looking back over my life, I was, both sets of grandparents came over from other countries, Poland and Czechoslovakia. And as my mom relied on her mother, she came over and helped, and we would go to their homes all the time, and my aunts, and even neighbors. I remember neighbors and friends. So it's that support system that you have to have. And I think that's what Building Blocks and other organizations here in Northwest Indiana are providing. They're providing that self-sufficiency and those safety nets and support systems that allow for vulnerable or at-risk populations to be able to thrive. And so I think that it's important as a member of Congress, we realize that as we're going through efficiencies and as we're looking at budget cuts, that we can do that and have a strong nation fiscally and still take care of the most vulnerable populations and don't leave anyone behind and create certainty for groups that are having an impact in Northwest Indiana. Because if we create confusion and chaos and we have no certainty, then services are going to get cut, vital services. And so let's focus on the positive side of things and have a fine balance. And that balance is being able to provide resources and look out for vulnerable populations. So down the road, we're not paying more. And what I mean by that is outcomes show if you can lower infant mortality and increase child development at a young age in the first 36 months, then down the road, you have a more productive student. Down the road, you have an employee. And if you have an employee that is productive, then you can bring big projects to Northwest Indiana, like a hydrogen hub that we're fighting for, that reduces carbon and creates 10,000 construction jobs. You can't bring big projects to Northwest Indiana at BP Amico unless you have a workforce, unless you have a productive student. And if you have educated students who can provide those jobs, whatever the field may be, then you have a quality of life and Northwest Indiana thrives. So it all starts with a seed, and then you watch it grow towards economic development, and then you make better lives.
That's right. And it's really about that network of support, that strengthening of our system across the board. We know that healthy moms make healthy babies. You spent 15 years as a township trustee, not too far from here, and you saw a lot of that taking place right there in your own neighborhood. Tell us kind of how that formed your ideas and thoughts and your vision as you then entered into Congress.
Sure. I think it's important to tell the narrative of what a township trustee does.
Yeah.
We had 153 employees, and I did it for 15 years. But what we did is we provided emergency assistance. It used to be called poor relief. But we had 80 case managers that every day saw 3 or 4 people who came in who needed help with rent, utilities, food, needed to be upskilled, lost their jobs because of things out of their control beyond their own. And we were able to provide self-sufficiency. We were able to provide hope. And so what we did, because we were in the middle of those battles and making sure that we provided for those most vulnerable populations, is we worked at that time with Franciscan, who brought together a collaborative effort of community stakeholders to be able to provide or lower the statistical averages of infant mortality and motherhood mortality in Northwest Indiana. And so we worked with resources, making sure that the community and that collaborative effort was able to make an impact. And it had a lot to do with outreach through the ERs, outreach through doctors' offices, outreach through emergency rooms, outreach through, at that time, federally qualified health centers.
Yes.
And so everyone was in a coordinated effort to lower those statistics. And it starts with healthy mothers. It starts with prenatal care, making sure that mothers understand what nutrition, what they have to have. And then it also continues after childbirth, making sure we don't leave people behind and pull the rug out from underneath a mom who is trying to make sure that their child stays healthy. And so the other side of what we were able to do when it comes to child development is we worked with a program, which I'm very proud of, which was Parents as Teachers. And very often my experience, your life experiences, and my experience as a North Township trustee takes me in a lot of different directions for sustainability and taking care of people. And so ultimately, what we were able to do there, I remember, no one, this is so applicable now, it's ridiculous. We were paying someone $20,000 to snowplow a driveway in a cemetery that we took care of. But yet we had 25 park employees that had trucks, that had plows, that we could do it ourselves. So when I came in, we eliminated that contract, and we used that revenue, because it was budget neutral, for a program which was called Parents as Teachers. And we were able to take, at that time, 20 families at $1,000 a pop to make sure that they received from 0 to, I believe it was 5 years old, and be able to have a family have a program which was Parents as Teachers. And that program had counselors go to the people's homes, make sure that they had education on financial services, nutrition. They dropped off books, and they were, as we used to call it, wraparound services for that family as they were going through childhood development. And the greatest thing about that program is the aftermath. When you're able to run into a family that says it was life-changing, you were able to see these families and children grow and be productive. And what term we need to really hone in on in this day and age is outcomes. And the outcomes, or what people want to hear now, return on investment of that $20,000, as they say in the commercial, is priceless. And so if we can remember that we are absolutely, if we measure the outcomes of programs that are successful in Northwest Indiana to lower infant mortality and to be able to create productive students, then I think we'll be better off. And it will be, as a member of the Appropriations Committee looking forward into Washington, D.C., we will have many battles coming forward on the prioritization of where our federal tax dollars go. And if we can focus on outcomes and return on investment and keep the seed of a motherhood and child and that productivity and what it means for economic development and quality of life in our communities, then I think we'll all be better off.
That's fantastic. I have to tell you, my family benefited from Parents as Teachers as well. We were a Parents as Teachers family in Porter County, and it's something that every family can use.
And people think we probably pre-planned that, but we didn't.
We did not.
It's very unique because I've got a million things on my mind, but as I was driving over, I was thinking that, and the outreach of that and the community, meaning the community of people who participated either in helping or having outcomes, is a great thing.
And we know from Professor Heckman's research, it's $13 on every dollar invested in those first 3 years. So that's a tremendous amount. We don't see that until much down the line.
Right.
And I wonder, being on the Appropriations Committee, do you see this ability among your colleagues to kind of delay that gratification, to hold off and understand that these are long-term investments?
Tough question. I'm not quite sure if the environment, if it will be evident when we sit down, but hopefully I can communicate that. That's why it is so important to proverbially have a seat at the table, to be able to tell these stories and to be able to stand up and talk about return on investment and what that means. And so I hope people aren't blinded by, well, we have to cut these programs in order to get this goal. And this goal, quite frankly, is tax cuts.
Sure.
And so we have to be able to balance it. I, again, believe that we can have an efficient government that can provide relief, lower our deficit, but yet still look out for our vulnerable populations. And so during this time, I think, to directly answer your question, it's my job to be at the table, to be able to discuss these programs. And like I said, tell the narrative and the stories of the return on investment that we would get from the outcomes of this, and not let people be left behind.
Sure. Have you noticed any change in kind of the attitudes around maternal and child health since you've arrived in Congress?
Well, we haven't been engaged yet on what this budget will look like.
Okay.
In the past, I sit on the Black Mothers Infant Mortality Caucus.
Yes.
That Lauren Underwood from Naperville chairs. And we were able to pass a bill that was able to get funding for those types of programs. We were able to get funding for other programs that allowed billions of dollars throughout the country to be dispersed into programs like yourself and others throughout the community to be able to help lower infant mortality. I know that as we go forward, to answer your question directly, yes, attitudes have changed. But now we need to see, when the rubber meets the road, what will that mean? What will those cuts look like? Obviously, this administration wants to make cuts. So now what we have to do is make sure that we preserve some of the basic foundation funding mechanisms to make sure these programs don't go away completely.
That's right. That's right. So we're here today with Congressman Mrvan, and we're talking about babies and moms and the health of our communities as we think about infant and maternal mortality. Let's pause for a moment and think about, or if you could explain infant mortality. Some of our listeners may not be familiar with that term or what that actually means.
Well, I'm not an expert, but what I believe that it means is that babies who are born that don't make it, that they are no longer alive, that possibly could have been had they had the support system put in place with nutrition, with vaccines, with health care, with support systems for the parents or the mother to make sure that they are able to take care of their child. So primarily, I would think it has a lot to do with nutrition. Primarily, I think it has a lot to do with coping mechanisms for new mothers. Primarily, what I believe it has to do with is a lot to do with making sure that, as we talked earlier, those support systems are in place for that mother and child. And what is your definition?
So, and it wasn't meant to be a quiz, I
No,
promise.
I get it. So we have common ground.
Yeah, so I think infant mortality, when we talk about that, that's a baby, any baby who loses their life before their first birthday. And we have far too many of those babies not making it to their first birthday. And that's for a lot of different underlying causes, whether that's nutrition or different things that happen in delivery or even prenatally that are really devastating to a family. And we feel the effects of that across the community. We also know that the number of moms who are dying before their baby's first birthday is also far too high, especially for women of color. We know that there's a great disparity in the number of moms who deliver and who also don't make it into that phase and to enjoy the wonderful experience of being a mother to a little one. So we so appreciate your work in fighting for that and really bringing awareness around that issue. There's a lot of ways to come at that, but I think first and foremost, it's a public health concern.
And, it's podcasts like this that are able to reach. That's the goal, right? To be able to lift the cloud of this isn't happening to me, so it's not existing.
That's
to
right.
be able to have these discussions to say, these are the vulnerable populations that we have. These are the statistics that we have within Lake, Porter, and LaPorte County, and this is what we're trying to do to improve upon that. And if we could do that as a community, I think we live in a better place.
I would agree. I think as we treat our children, that's what we value. So, who do you find to be your allies in your work as you're moving forward into this session and going back to Washington D.C.? Who do you consider to be your BFFs?
Well, as someone once said in Washington, get a dog if you want a BFF.
Okay.
But I think it was Truman. But ultimately, you want to build relationships and network. That is my job. And so, obviously, Lauren Underwood is a champion. She's a nurse. She's someone who is a caring individual that's trying to make an impact on infant mortality and not just talking about it, putting legislation and resources together. So not only is she an ally, but she is someone who is a champion for this cause. So now we move towards the Appropriations Committee and the Health and Human Services Subcommittee in which these fundings will go through. And so my new BFFs will be the chairman of Health and Human Services. My new BFF will be all the Democratic members. There's probably about 13 members on that subcommittee. So we'll submit letters, but it is my job as a member of the whole committee, not to get confusing, to be able to advocate for things or prioritize things that are important and to be able to have a voice. So we will absolutely, positively be talking to those members of that subcommittee that are going to be putting forward that budget through markup. I know I'm in the weeds now, but basically the funding prioritization of Health and Human Services that will come out of that subcommittee, go into appropriations, pass the full House, and go before the president. And, historically, the reason why we have the Appropriations Committee is because the power of the purse and the 14th Amendment. I don't want to go off, but we have a lot of things going on with executive orders that are cutting and freezing funding. And I believe that there is a constitutional divide between the executive and the legislative branch. I believe that the power of the purse goes to the Congress in order to make these funding requests. I say all that is because the administration is the same party that is in the House, which is in the same party in the Senate. And there are people in the House, when we talk about BFFs, that there's a governing majority of individuals who are in the middle that want to be able to do good things. And like what I'm going to consistently say, and not to, but I believe this, is that you could you could still trim, you can become efficient, effective, you can lower deficits, and you can continue to care for your most vulnerable populations. So if we could do that, then those will be my BFFs. So it's always, it's my job is to make sure that I have ongoing relationships that you may not get along with someone or like a cut or a piece of legislation, but you don't burn that bridge because you don't know when you're going to need them next. And as a member of Congress, when you run every 2 years and you have to pass a budget every year, you can't afford to have enemies. You can only afford to have long-standing relationships and prove yourself credible by your word and your trust. So that ultimately is my goal.
That's wonderful. As a former kindergarten teacher, I think you've learned the lessons, right? Be kind, be
Play
patient,
well in the sandbox, right?
Be nice
It's a
to
simple
others.
rule.
That it's easy to follow. And we were so pleased to hear your words on behalf of your constituents here, this abject frustration that you feel around this balance, this tension between the efficiencies that are necessary to trim the cost of government, but also, like you say, protect our most vulnerable citizens.
There needs to be a checks and balance system. That is our foundation. And I'm going to do everything I can to make sure we maintain that.
And so who do you need to hear from here in Northwest Indiana?
I need to hear from everyone who feels uncertainty about what their future holds. And to be honest, a lot of people are doing a good job of hearing from them.
Okay.
I've been doing this. This is my 5th year, and I have gone through a lot of unprecedented times over these last 4 years. And I only mention that, no boohoo for me, but we receive, when all of this was going on with the freezes, 400 to 500 to 600 phone calls a day.
Yes.
Now, that's not including emails. That's just people picking up the phone and saying, hey, what is going on here? Or I am impacted on the Medicaid side. Or what is going on with my Social Security benefits? I don't know if this is the platform and to go to that, but people absolutely positively want to be heard and know that this isn't what was anticipated when prior to these last 3 weeks. So I consistently say that people want certainty, and it's my job to create calm in any type of chaos.
What do you anticipate might be some of the impact or effects of these federal freezes on the programs that we have existing here in Northwest Indiana?
Well, I think the federal freezes, as we were talking earlier, is if there are programs, if there are institutions that are heavily dependent upon state and federal funding and everything is frozen, I guess the best thing we can do is have examples, right? There were federally qualified health centers that went to portals to be able to pay their employees through allocated funds from last cycle that weren't granted access. So these are medical providers throughout our community, Northwest Indiana, that are taking care of vulnerable populations on a sliding scale and adding to access to healthcare, access to mental health, access to dental, and taking care of our communities and populations that need it most, that had zero funding, had no access. And so there was, as I mentioned, a great deal of uncertainty. Now, I believe that we can do things that don't create that chaos, that don't create that confusion. And if we can go forward with that, I think that's a good example of individuals or groups that were impacted.
Of course. What other programs do you see or that you are interested in learning more about in Northwest Indiana that will advance the health of moms and babies?
Well, I want to learn about everything that exists.
Sure.
And be part of and let them know that they have an advocate. As I mentioned in North Township, I know that there was an alliance with Franciscan and stakeholders that were working together. I know for a fact that federally qualified health centers had their own programs with providing nutrition and counseling to new mothers. And I know for a fact, as I've gone out to Porter County, there's a great effort to be able to reduce that, and in LaPorte County. So making sure the United Ways and other funding organizations in those operating worlds, spheres, have my support. And I know what makes me a good legislator is knowing the programs, being part of it, visiting those organizations, and being able to go back to the table in appropriations and tell that narrative. So ultimately, it's an ongoing learning process, but all of the organizations that are here trying to lower the infant mortality rates and mother mortality rates are something that I want to learn from.
Of course, of course. What message do you have for moms of Northwest Indiana? How do we, every mom, was it John F. Kennedy said every mom wants their baby to grow up to be the president, but maybe not a politician first. What advice
You've got a
do
lot
you,
of quotes.
I'm a reader.
Yes, you most certainly are. Holy smokes. But it's good. Go ahead.
I was just going to say, what advice do you give, or what hope can you give for our mothers in Northwest Indiana?
I think this is very applicable in a lot of different things. The first thing I would say to mothers who are facing challenging times is you are not alone, that people want to be able to assist. So if we can send that message that these organizations exist to be able to help. And then secondly, as a township trustee and a local elected official, what I know to be true is people feel shame, or because they feel alone and isolated, they don't seek help. So we need ambassadors to be able to reach out to people or vulnerable individuals who might be in that position to let them know they're not alone and what help exists. And if we could do that, then I guess that is the building block of success, letting people know that they're not alone and overcoming that shame of maybe seeking out assistance, and knowing that if everyone has a little bit of knowledge of programs that exist, we can help other folks get through hard times.
That's our greatest message, right? You're not alone, and it's okay to ask for help. Having a new little one in your home can be really challenging, no matter what your address, no matter what your background. And so knowing that there are resources
And I
out
just
there.
flashed back to my daughter who started teething like at
Yes.
8 months, who never slept.
Never.
She never, ever slept. And a great story is I was a salesperson, and I remember going and calling on an account. It was at a doctor's office, and a doctor who had 4 children had like baby food on his white smock and like had a sock. And I was like, what is going on with you? I didn't have children yet. And then after I came in, and I was the one who had the sock in my pocket and like food over me and hadn't slept in like 48 hours. It's tough. It's tough work. It's obviously the greatest reward on the planet Earth. My daughters are 22 and 18. But early childhood is, and then it puts stress, on you and your wife. Who's getting up? Who's not? Who's working? Who's not? Childcare, which is a whole nother aspect of it. Reliable, dependable, trustworthy childcare for new parents is a whole new another aspect other than infant mortality. But we need to focus on that also.
It's really about taking care of families. And I know you've devoted your entire career to taking care of families, especially here in Northwest Indiana. And again, we're so grateful for that. We're about ready to wrap up here with Congressman Mrvan. And I just want to give you an opportunity to let our listeners know any message you want to share with them at this time.
I think that the greatest message that I could say, Mary Jane, is how important it is the work that you do and the organizations that support you.
Thank you.
And so using this platform to be able to reach new people so they understand what is available, and letting people know, like we said, that mothers are not alone and families are not alone, and there are safety net or support services that are out there to help communities. And then it's my job to be able to go to Washington, D.C., to be able to bring resources efficiently, have them dispersed, efficiently have them go to organizations that show that they have outcomes to be able to provide that those dollars have a return on investment. And if we could do that collectively, then I think that we will be doing justice for our community. So the bottom line is all the grace and thank you to what you do, your organization, every single day, and know that in Washington, D.C., you'll have an advocate to make sure that we give a voice to the voiceless and help people who are the most vulnerable.
We can't thank you enough. And please know that we're here for you. If you have questions, if you need us to find more quotes or do some research for you, we're happy to do that.
I appreciate that. And what I want you to know is, from my lens, I know it takes preparation and it takes a lot of things to put this together. So I thank you and the organization that allowed me to be here to have this conversation and to make me a little bit smarter and a little bit more knowledgeable about what you do so I can go back and advocate.
It's really been an honor, and we're so fortunate to have our Lakeshore Public Media team and the work that they do to share these stories. They're magicians in my book. They create this magic here.
They are magicians, and I hope everyone at PBS knows that it is magical and how important it is for them to be part of our community.
Absolutely. Great. Thank you again.
Thank you very much.
Legacy Foundation is Lake County's community foundation. For over 30 years, we've partnered with donors and nonprofits, focusing on youth development, the arts, the environment, health, literacy, and other causes that matter to you. We're committed to Lake County forever. First Things First Porter County is dedicated to supporting families, healthy beginnings, and quality early learning, ensuring every Porter County baby is born prepared for a strong start in life. Learn more at firstthingspc.org.
I have a very strong connection to other students. Everyone makes an effort to help each other. I'll remember the feeling of being here, the feeling that I was a part of a family.
Additional support for Building Blocks is provided generously by Tom Sorlis and Sue Eleuterio, as well as Porter County Community Foundation, serving Porter County since 1996.
Building Blocks the Podcast is a co-production of Lakeshore Public Media and First Things First Porter County. For more information on Building Blocks, including this podcast, as well as the television show, visit lakeshorepublicmedia.org/buildingblocks.